Okay, so good evening, everyone. I'm happy to welcome you to the first session of the webinar of Medbury Medicals. And today we'll be talking briefly about COVID-19 and the effects of working from home on employees and business performance. So without much ado, I'm glad to say today that we have right online, we have Akintunde, we have Mr. Dapo, Omolade, and also Dr. Lanre Ajayi. So my whole name is Akindele Ogunoiki. I also work with Medbury Medicals as the head of business development. So without much ado, I'll just go straight to introduction of our guest speaker for today. I'll start with Faith Akintunde. Faith is a performance and productivity advisor, senior human resource business professional, and a founder of HRPR Leverage, HRPL Academy, and Finance Pro Leverage. She is a value-driven HR professional with varied work experience across financial services, oil and gas servicing, and the manufacturing industry, with expertise in performance management, talent management, learning and development, and competence-based people management. Faith was named a top-rated HR influencer, nominally on the most inclusive HR influencer list, that's to 2019-2021, and a subject matter volunteer with HR Certification Institute in the US. So without much ado, kindly help me welcome Faith Akintunde. Joining also is Dapo Omolade, who is a qualified safety practitioner, consultant, and auditor with more than 20 active and consistent years of experience in occupational health, safety, environment, and project management, administration, operations, training, and consulting for clients in various sectors of the economy. He is also the CEO of Hybrid Group Limited, a one-stop shop for safety and allied services. He is the chairman of iOS West Africa and the national coordinator of Safety Advocacy and Employment Foundation, SAEF, a registered NGO in Nigeria. He has also been involved in human empowerment and capacity building in the areas of HSC as a safety entrepreneur, trainer, coach, mentor, and regular speakers at seminars, workshops, and other programs. With much honor, I welcome today Mr. Dapo Omolade. And lastly, to coordinate this event today is also a well-sound professional, that is in the person of Dr. Lanre Ajayi, who has over 19 years combined exposure in clinical, administrative, and academic occupational medicine. He is the lead occupational physician at Medbury Medicals Services, and in addition, is a visiting faculty at the master's program in occupational health at the Department of Community and Primary Healthcare of LASUT. It teaches subjects such as occupational health, occupational toxicology, and occupational safety, and its experience spans across clinical OH practice, occupational health in the offshore industry, and OH practice for operations in major hazard sector. He is a graduate of medicine, and he holds postgraduate degrees in occupational medicine with distinction from University of Otago in New Zealand and occupational and environmental health and safety management from the University of Portsmouth, UK. He is a member of Faculty of Occupational Medicine of the Royal College of Physicians of Ireland. And I can tell you today that some of his interests also include occupational toxicology, fitness for work, disability assessment medicine, and crisis management. So today, I welcome to the house Dr. Lanre Ajayi. Thank you very much, Dr. Lanre. So at this point, I would welcome Dr. Lanre to take it off from here. We would like to have your video also to come on, Dr. Lanre.
Okay, I think I probably will need to change my location. Just bear with me a second.
Okay.
I didn't know Akin would be asking me to uncover my face, so
You-
okay.
It's good to see you, Mr. Dapo.
Yeah, it's a pleasure
Yeah,
meeting you again, Akin. Nice
yeah.
to be here. Thank you so
Thank
much.
you.
It's a
Thank you
pleasure.
for accepting.
Thank you.
Right. So we take a moment to wait for Dr. So I hope that the agenda for the day is after the introduction, we have the discussion session for roughly about 40 minutes, and then we have opportunity for people to ask questions related to the topic for today. So once again, today we'll be talking about COVID-19 and the impact of COVID-19 of working from home on employees and basically business performance.
Okay, I think I'm
Yeah.
able to. Right, okay. Thank you so much, Akin, and good evening to everybody, particularly to our guests, Dapo, Omolade and Faith. We feel very honored to have you join us. Thank you so much. And to all the people who have joined us, we say thank you very much. Welcome you very warmly to the maiden edition of this webinar. It's going to occur in series, quarterly series, and this is the first of its kind. And we we will be planning another one sometime in September. We'll let you know of the time nearer that date. So welcome everybody. So without much ado, I think we will just jump into the business for the day. Right. So it's about COVID-19 and the effects of its effects on employees and business performance or productivity. I think all of us, we are witnesses to how the virus has upended our lives in many ways. I think it's even beyond now. It's just a public health issue. It's quite diverse in the way it has, affected all our lives. It's political dilemma on one hand. It's also occasion economic decline for countries, for organizations, for individuals. It has forced business to rethink the way they do their thing and to redesign their operations, if you like. Comes with a lot of conspiracy theories. I don't think I need to remind you of the many that you, I'm sure, have heard along the line. And that's even at a societal level. At an individual level, everybody has their own different lived experience, from either loss of income, loss of job, a feeling of isolation, stress, behavioral modification. All of us can't leave our houses or go to some places now without, remembering to put on a face mask or something like that. But it's actually the impact of all of these on the employment space that we want to explore today. And Akin has introduced our guests, Dapo Omolade and Faith Akintunde. I will just go on straight to them. Welcome to both of you. They say ladies first, and if you will oblige me to take that angle today, Faith, I'd like to start with yourself. Right. Okay. So let's talk first about performance, or if you like to call it productivity. I, the the data is incoherent with regards to the effectiveness of working from home. Some people say it's more effective. People find that they are more productive when they work from home. Other data come out to say that no, that's not the case, and so on and so forth. What are your thoughts, if you've got any experience of your own with regards to working from home and the effectiveness of that on productivity?
Okay, so if we take working from home, so I mean, before I respond to your question, I'll say thank you. Thank you for having me. I count it a privilege to actually be here. Um, so talking about working from home, if I would speak from experience, my experience and experiences of people that I've either interacted with or managed directly or have partnered, um, taking it from working from home. So if we look at that, we're saying we're working from home, not anywhere else, working from home. Now, I would say that there is a bit of data, but it's not sufficient because there is something that is called limited relevance of data. If you pick data from South America, I'm sorry, North America, or the Americas generally, and you pick data from Europe, and then you pick data from Africa, the way the data would behave would be different across the region. So a lot of us tend to pick data from this part of the world, and we want to adopt the exact results of this data into our spaces, let's say in Africa. It doesn't work absolutely, I mean, in absolute. Yes, we're humans, but there's the diversity angle to us. There's environmental factors that differ. In Africa, for instance, or let's say Nigeria to be specific, the requirement for power supply is not the same as is in the western part of the world. So if we want to pick data, we've got to be careful in picking data from certain part of the world with different kind of dynamics compared to the dynamics that operate where we work or in the space where we operate.
Right. So if you allow me to jump in, if you allow me to jump in, so if we narrow this down to the Nigerian labor space, do we have, even if it's not aggregated data, even if it's just something observational, you know, do you think that people prefer to work from home, or do you think organizations benefit from people working from home when you compare that with people working from the offices?
Okay, so from, just to continue that line of thought, speaking from the perspective of the people, the flexibility that working from home brings, and based on interaction, a lot of people prefer to work from home, especially because it saves a lot of energy, saves a lot of time in terms of commuting, especially if you work in Lagos, for example. You spend an average of 2 to 3 hours in traffic to and fro. You would save that on your productivity if you don't have to make that trip and then you work from home. For some persons, they prefer to work from the office or work from the workplace because of the realities at home. Maybe there's no power supply, they have to further gen on their own bill, they have to make sure there's data on their own bill. So the population that would prefer to work from home would be those that have all it takes and are willing to trade the costs in terms of stress and time of traveling to work versus conserving that cost and spending that cost on staying at home. For moms, there are some moms that would prefer to work from home because it gives them that flexibility of do the school run, you're still able to come back to your desk, get the job done, and then come back again at, your break time, pick the kids, and come back to work, after you've picked the kids. So for the flexibility it brings, a lot of people prefer to work from home. But if I'd say a lot, that would be unscientific. And if you want to speak to data, I wouldn't be able to pick specific number to say, oh, this percentage prefer to work from home. But from my experience, the younger generation, right, find it more interesting to work from home because, of course, there are not so much dynamics to, I want to take 2 hours off, take these hours off. They would focus on the job that has to be done at that point, and they get it done. When working from home, a lot more younger generation would bring more productivity to the table compared to people that have a lot of other responsibilities to combine.
Okay, so sorry. Thank
okay.
you. Thank you, Faith. Thank you so
Okay.
much. Don't worry. I see you've got a lot to share with us. We will give you opportunity as we go along. Right.
That's
Okay.
fine.
Thank you. Thank you for that. Thank you so much. Just to quickly say that we will encourage you to put your questions, if you've got any of them, in the chat box as the event continues. So if you've got a question, just put them on the chat box. At the end of it, we will collate those questions and we will try to address them as much as we have the time to do so. Another thing that will come up sometime in the program is a poll where we try to collect your feeling about your preference for whether you like to work from home or you like to work from the office. I know Faith has said the younger people. I don't know how many of those people are here, and I do not even know what younger means. But anyway, we will try to gauge your polls to see what our audience thinks about them. Thank you so much. Now to yourself, Dapo. I think one of the things that has worried me, or at least I have thought about when it comes to this issue of work from home, is the question of duty of care or the question of liability. It used to be the case that you're going to a workplace, whether that be an office or whether that be a shop floor, and it was, immediately without question, who has a duty of care for you. That's certainly your employer, because you are going to work on their premises. Things have changed. The office is no longer a factory or a shop floor somewhere, or an office location somewhere. It's somewhere in your own home. The question is, does an employer still have a duty of care to an employee that works from home?
Thank you so very much, and nice to be here. And thank you so much, Faith, for that very good introduction. I think I'll just ride on some of the things that you have said. And when Larry was asking younger, and I raised my hand, he didn't recognize that because I believe strongly that younger age that he's talking about, I think I belong to that group right now that Faith said, that want to work from home. And definitely this is no longer by age or by whatever, but I think for me, the COVID brought this to me, which I didn't know, or I didn't think I desired it so much until the COVID. And now I'm beginning to think very seriously that, okay, maybe this is just the best. And I have a few research to back that up, to prove to myself that I'm more productive when I work from home. And many times I've made it clear to my team, when I have very serious work to do, I call in to say, today I'm working from home. I've got so much to deliver, and I get myself doing it exactly. So, but we'll come back to that later. But with respect to duty of care, Lanre, as you have mentioned, I think what we need to be looking at right now is the duty of care is by virtue of work. And therefore it means it is work related. It's not facility related alone. It's not building related. It's not machine related. It's work related. So if you take it from that angle, that what we're looking at here is what has to do with somebody doing his job, either at home or in the office, then the employers absolutely will still have to take up that responsibility of duty of care. It's not something we're going to throw away. Now, the situation we have found ourselves right now is that COVID-19 brought something to us so quickly and so fast that we had never really planned for. I've attended a couple of trainings, but 4 years ago, I did a course on business continuity management system. And I remember this was mentioned very clearly in that discussion about the fact that there had to be plan for crisis or what can come in. And when those crises come, employer will still be responsible because the crisis has been generated, or has been, put it this way, the crisis have been caused, just in bracket, has been caused by the employer. as I always maintained, employer is the owner of the work. Employer is the person that has hired me to work for him. So therefore, if anything happens to me in the course of that work, either in the air, on the tree, or in the sea, or in my bathroom, anywhere I find myself working, on the employer's account of a duty that he has given to me, then he has absolute duty of care. Now the question is, how do we measure this? How do we determine this? That's where the challenge is right now.
Now you took that right out of my mouth, okay? And thank you so much for that introduction, which I think is brilliantly done. We now take a very practical example, and still on yourself, Dapo. I'm working from home. My employer is who has given me the work to do from home. And then I want to stand up from my workstation to go to the bathroom, to go to the kitchen. I trip, I slip, I fracture an ankle. Now, how does the employer verify that my account of that incident is as I have stated it, and it's not when I'm playing football in my back garden?
All right, thank you so much. Like these are the big challenges that we are all looking at right now. These are the things that we need to determine. I had a very beautiful presentation with an oil and gas service company this last week, and this discussion also came to the fore. And I mentioned in that meeting exactly what I'm going to say right now. Employer has better begin to look at how this will be captured, because eventually it's going to be employer's headache. And I give you an example. If employer refuses to accept that I actually fell while I was working, the fact is, what if I'm unable to come back to work again? Who is losing at the last part of the whole equation? The employer has a lot to lose, because I've been trained by the employer, I've been empowered, I'm the anchor person for the employer to get that job done. And I do not really take into cognizance how that job is being done in my home. If I get injured and I'm unable to come back to work, or let's say I lose my life in that course of work, the employer also have lost a whole lot of investments that they have placed into me. So therefore, they need to start looking at that right now. And I said, technology will have to help us here. And Faith said this very well. In Nigeria, this may be a difficult thing right now, but let me give you a typical example of friends that I know that are working in other clients right now, whose employers are monitoring their work per second. So technology has come to the fore. They have to be able to say you're on your system. Now, if I work as somebody that have to use my laptop to do a lot of work, then I could monitor how many seconds, minutes, hours I spend on that laptop. Now, I could be doing something differently, but the employer can also monitor that. So a friend told me his laptop was configured with a certain software, and therefore, anytime he switches to do something out of the work, the employer can tell you at the end of the day, you've only spent 2 hours for us today. That's technology. Technology has to come to help us in managing this risk assessment that we're talking about here, because work is work. If I get hurt while I'm doing that job, employer has better start investment. So the next coming year, we're going to see a lot of technology and investment into technology in this working, because working from home has come to stay. For me, is the way to go. I'm not turning back, even personally. Therefore, employers are not going to turn back, but they must find a way to manage this risk. And that's what we'll be talking about in the coming years.
Great, fantastic, Dapo. Thank you so much.
Yeah.
And
Sorry, if I may add, right?
Okay,
Dapo,
please go ahead.
I mean, that was a very fantastic one. And I think that talking about technology, as much as we'll say, oh, Nigeria is, requires a lot of work in terms of development and catching up, I know that there are a couple of organizations right now that use some kind of software right now in Nigeria that can tell you how much hours you have spent on within the office environment, right? Not physically, that's, virtually now.
Virtual office,
now,
yeah.
Yeah, there are also applications that you can use to measure the extent of job being done. Now, for not mentioning names of brands and all of that, I know there are applications that you could use to confirm, oh, this task that was assigned to you, how long did it take you to get it done, and you can feed that into some other performance-based applications that can measure productivity.
Absolutely.
So it's already possible in Nigeria.
Thank you.
Okay, great, fantastic. Thank you to both of you. So I go straight to yourself, Faith, and I'm still talking about these remote monitoring, performance assessment, and things like that. Dapo said something that working or work from home has come to stay. We used to say in the space of occupational health and safety, that it belonged to the future of work. You know, we used to say that. We didn't know that the future was right with us when we were saying that. And we didn't know that coronavirus was going to do a number on us and fast track events. So we are now transported, you know, maybe a few years into the future. So it has come to stay. The question is, how can the Nigerian employer or the employing complex, you know, take advantage of work from home? That's for Faith.
Yeah, so there's a lot of advantage. Yeah, thank you. There's a lot of, also there's a lot of dynamics to it. First, I'd say organizations should begin to consider a blend depending on the industry where they operate. Some industries might do 60-40 of working from home, depending, because I would like to be, I like to be quite realistic. If you pick manufacturing sector, for example, there is nothing that the shop floor guy wants to do from home. He has to show up because he has to run the lines. He has to make sure there are materials and all of that. So the guy that is operating machines, except if the machine can be remotely operated, then you can talk about remote working and you want to run the lines and all of that. But for machines that you have to start and stop on site, they've got to show up. For service-based industries, I know the tech organizations have already, translated, I'd say 98 to 99% are already working from home. I know places where people have worked for a year now and they have not even met each other physically, and they're working and getting things done. So working from home, I agree with you, has come to stay, or let's say remote working has come to stay. But depending on the industry where the business operates, it has to have a blend. Now, maybe just taking a step further, in terms of the advantage that is a need for the employer. It's important not to take it hook, line, and sinker that, oh yeah, employees want to work from home. When they work from home, they're going to be productive and all of that. No, there are people that actually prefer not to work from home. There are people that prefer to have a blend of both. I know someone in my organization that prefers to do Monday to Friday, 8 to 5, working from the office. Because in their own view, when they're at the office, they get things done, they collaborate better, they have lesser issues to worry about. If you want to fix something, you get it fixed immediately. Some other persons in the same workforce prefer to work from home 100%. So employers have got to deep dive into the preference of the people, the kind of work that the people do, and the kind of requirement for such work. So there's not going to be one size fits all. In fact, irrespective of that industry, it's advised that you have a mix and then you understand the preference of the people. Fantastic. With that, you would be able to get the buy-in of the workforce and they would be engaged.
Fantastic. So I hear you when you say flexi working is probably to be prioritized above a stack work from home 100% or a stack work from the office 100%. So going into the future or going ahead, we will see a lot of flexi working, which is a hybrid of working from the office and working from anywhere. Okay, great, fantastic. Right. The issue of mental health, or what I generally put in the big basket of psychosocial risks. The issue of mental health is a very topical one. It's the awareness about mental health conditions is growing in Nigeria, and we cannot continue to shy away from it. But particularly so when people find themselves, locked up, especially during the lockdowns, and then having to work from home. People have reported higher incidence of mental health issues, whether that is in relation to stress or to some other things, from being contributed to by work from home. Dapo, I'd like to have your thoughts, from a health and safety perspective with regards to what can the employer do to mitigate this risk?
Very much, Lanre. And again, this is real, and this is something that, of course, you personally as a professional, I always leave this to the likes of Larry and the rest of them who are called medics or medical people, because mental health is big deal in this part of our world. And the truth is, you have captured it very well. It's actually growing in very serious large numbers right now. People are having, it's interesting that you're seeing people talking about being depressed and being suicidal right now. And the reasons for this are not far-fetched. We have come into the future of work that we're not prepared for. That's the first thing. I was one of those people about 3 years ago, 4 years ago, we started talking about future of work. I did a lot of presentation on future of work. Perhaps I didn't even understand what I was saying then, but I knew something was coming. And then what was the planning? Again, myself typically. 2 years ago, or thereabout, before the lockdown, I created an home office. I've always had an home office, but I created an home office. I just said, sometimes I would like to work from home. And as I thinking about working from home, but I just couldn't, maybe I couldn't even talk about it to anybody. But in my mind, I've delivered some presentation that working from home is part of the future of work. So I was trying to create something like that. And a few times I tried to do it, and then I met with so many challenges at home. For example, working in my office, I've got a very good air conditioning system, good table and chair, and now I'm working from my home on a bed, and I don't have a table, or I'm on a sofa that is not comfortable. I'm removing my chair because the heat is so much. Even when there's power, I can't turn on the AC because at the end of the day, I've consumed maybe 30 units of power, more than what I would have consumed if I disappeared to the office. This alone brings stress, financial stress. It brings dependent stress. You start thinking about so many things, and then you actually think you are working. On indeed, you are working, but you are also getting into a state. That state, unfortunately, is not defined, and we are not aware. That's why there's a lot of outbursts right now. Mental health is not something, the only thing we all know about is stress, and that's all. But suddenly, people work for about a year without any structure to work. No structure from the employer, no attention from the employer, no cause from the employer, no care. You just deliver this. After all, you got your laptop with you. Okay, I give you 5,000 naira as internet fee. Is that all? Or I give you, and whatever you give, we must know that it's not equal to what I used to have in the office. Therefore, within a year, I've tried to deliver so I don't lose my job. And I'm going gradually into a state which employer should be talking about. So I think it's, again, going back to employer, because mental health is a risk of working. And employers are expected to identify the risk to the employees and to provide suitable controls to make the risk either go away or reduce it to a large extent. I read in the paper recently that there's a whole lot of domestic violence going up at home right now, even in Nigeria. And Larry didn't want to say the other reasons, which is I come home, a typical example, I work, my wife work, we only leave home in the morning, and we come back in the night, so almost 12 hours we're not seeing, but now we are seeing every minute. I don't know if you saw some jokes on the internet and on the airspace where people say, okay, I have a big problem. What's my problem? I can no longer stay at home with my wife or my husband. And people laughed at this, but this was a major issue because you have not been used to seeing this person 24 hours a day. Now you are seeing 24 hours a day times 12 months. Come on, something happened if you do not have a good relationship. You are still delivering at your work, but now you're having issues at home. And then you start beating one another, or the kids start getting beaten, or somebody start getting beaten. Whichever way, there is stress, there is violence, there is mental health. Employers' responsibility must be to manage this. And the only way to manage is to first identify it as a risk, which is what we all teach in risk assessment for an organization. Thank you.
Fantastic. Thank you so much, Dapo, that you delved into different dimensions of the topic. You talk about spousal conflicts. You talk about sibling frictions. You know, I know that for a fact, and I do not know why you put me on the spot when you said I didn't want to talk about the other part. Do you know something I don't? Anyway, all right. But that's really the case, and it is one of the factors that is increasing stress and, of course, mental health issues. It's not the only one. There are many other issues, and we'll get into some of those as we go along. If you are just joining us, you're welcome. This is the webinar organized by Medbury Medicals Services, the first of its kind. It's going to be quarterly, and the topic we are dealing with today is COVID-19 and the effects of working from home on employees and business performance. And the screen is up there. We have two seasoned people looking at the topic for us, one from an HR point of view, the other from a health and safety point of view. If Dapo, you talked a lot about setting up your home to look like your workspace. And I'm going now to Faith, and we are talking costs. So Dapo is able to afford a good workstation. Dapo is able to afford good, fast internet. Dapo is able to afford a generator that he said he pulls off his check. He doesn't do that. He puts on the generator that takes all the ACs in his house. That was able to do all of these things to make his home a conducive office. Who bears the cost? Who bears the cost?
So if we're to speak to this from science, I say, okay, based on what ought to be the ideal, it should be the business, it should be the organization, your employer. Of course, based on the fact that you're working for the employer and these resources you got because you're working for the employer. So the employer should bear the cost based on those conditions. Now, can the employer bear this cost? That's a question. I know that there are some organizations right here in Nigeria that invested in workstations for their employees. They ordered for them, they were delivered to respective employees' homes in this country. So there are organizations that can afford such a workstation. The table, the seat, the comforter, of course you already have your laptop, but they're not going to fix your room with AC anyways. They're not going to buy you new generator and all. But I also know of organizations that would add some stipend to your cost of power, that's energy generation. I know some organizations that invested in some mini power generators. I wouldn't mention brands, but there are organizations that have the small ones that can light, charge your phone, charge your laptop. It's something that can serve you for 8 hours. Now, the employer did a deal such that they can pay down over a period. I can't tell the ratio of ownership and how it works because such resources would be home. You can't stop the employee from using it to maybe plug their TV or plug the laptop to watch Netflix and all that. So there's going to be some level of cost sharing in that. But I know that some organizations have invested in such, and it actually did boost the morale of the employees, boost the level of engagement. And of course, the employees would prefer to stay with such employer. So to round it up, I think it's going to be on a case-by-case basis because you have SMEs that are even still struggling to pay salaries. So if an SME that is unable to pay salary is saying, guys, let's be productive or stay and work from home, you have your laptop, we'll give you data just to ensure that you keep this job. I think both parties have got to look at it that, oh, we're trying to survive right now. But there are some organizations that can indeed afford it. And if they can indeed afford it, it's only fair and wise to go ahead to do that because there is a lot of benefit that comes with it. The employees know where these things are happening, and if they find the chance, they're going to move. But some employees will actually stick to that employer that reasons with them and understand that, oh yeah, right now we're not able to do bigger, but we're communicating and we're clear that, yeah, if we're able to do bigger than this, we can do it because, we would do it because we have the willingness. These are the resources is not there. But our priority right now is to ensure that you have a job that can pay your salaries and then at least you can survive rather than lose your job. And of course, start looking out for jobs because we know that during COVID, a lot of people lost jobs. And we're not here to cast aspersions on employers that couldn't survive, but to focus on the reality that if your business has gone through the tough times and your employees are working from home or have business to work from home, it is only fair to support them to enhance their productivity while they work from home. Talking about workspace, I had to invest in one as well. And of course, not my employer. My employer didn't foot the bill. So the realities are different from based on industry, based on the size of the business, based on the kind of organization we're talking about. I hope that helps.
Yeah, no, that's fantastic. Thank you very much. And for those,
please, before you go to the next question, can I just throw a spanner into this discussion? Just one thing I wanted to throw into what Peter said.
Yes, please. Yes, please.
Okay, I may not discuss it, but something to look at later because Peter said it very well, and coming from the point of what you will consider as a win-win or a win-win approach to managing this. But let me switch on my health and safety cap. And the question I'll be asking is it about affordability or about protecting the workers? Health and safety law never says anything about affordability of control. It says you must provide adequate control. So when we get into the legal part of this, now we are not able to do this right now because we just found ourselves right here and we are struggling. But as we make progress, there will be litigations. And when litigations start coming up, it will no longer be, can you afford to control or protect your workers? It will go to, you have to control the risks they go through. So it's not going to be affordability, but necessity, because that's what health and safety says, even at the law. Thank you.
Right. I agree. I agree with you. Absolutely. And talking of health and safety, I'm pro health and safety. And I do not speak of affordability as a disadvantage to necessity. But you know also that if we look at the realities, if we have to do all that is necessary and we cannot run business, I'm sorry, I'm an economist, and so we have to just look at the balance. If we have to do all the necessities at the expense of the job itself, meaning the existence of the job itself, a lot of businesses invested in furnitures and there are no more. So I think as much as we're going to look at the necessities, which is number one, the business, the employees have got to work together to ensure that there is sustainability. That's what I was trying to put forward. And I agree. My hands are up.
Fantastic. Thank you for that rally. I think it's a rally. That's what you call it in tennis. I think it's me preparing for the finals, the Wimbledon finals. Right, fantastic. Thank you. Now let's talk about, and Dapo, by the way, you say you are putting on your health and safety cap. Yeah, that cap never leaves your head. So I don't know where you're saying you're putting it off again. Right. Let's talk. Okay. Okay. Now, let's quickly talk about organizational resilience. I think that's now a buzz terminology in this pandemic where when people are talking about preparing and positioning for the future, they are talking about resilient organizations, agile organizations, organizations that are moldable and can quickly at very little notice, transform and carry on. Okay. Now, with regards to the Nigerian experience, and I'm starting with yourself, Dapo. With regard to the Nigerian experience, what does this mean in terms of health and safety as we go on? And when you finish, I'll jump back on Faith to let us know, how organizations can even be resilient, at least from an HR point of view.
Yeah.
But from your point of view, what should
All right.
organizations
So
be doing? Yeah.
Yeah.
Go ahead, please.
Thank you. Thank you very much, Lanre. I'll be very quick at this because there are things that are basic that unfortunately in our own client has never been at the forefront. Resilience is a big deal for organization because I mean, Faith just talked about sustainability right now. The most important thing that every company or every organization needs to know is that nothing lasts the way it goes. There will always be those kinds of ups and downs. Now, those ups and downs must have been considered in the course of the business principles of work and operations, meaning there should be planning on those identified indices that will make your business resilient when this crisis come. And I'm one of those people who have been at the forefront before now to say that organization, health and safety for me has become a tool for sustainability and resilience. I never understood this. But at some point, I began to understand that everything we're asking you to put in place in health and safety perspective is to make sure that your business can survive when a crisis period comes. And those crisis periods be as simple as an accident or a fire to your building or the COVID-19 that suddenly came to everyone. And then a lot of companies, I mean, you can attest to that. Health and safety people had more work to do in the course of that COVID-19. Many organizations, for the first time in their life, appreciated health and safety team because they suddenly realized that, oh, these are the people that can now be at the forefront to help us as a business. They are the ones that have to look at all the parameters. So I think basically business must begin to look at those things that matter right now in this future of work for resilience. You must have planning in place. Technology is no longer an alternative to any organization. As a matter of fact, a big part of BCMS, Business Continuity Management System, is technology. We have to now begin to think, and that's why I appreciate a lot of the tech hubs around now. And even myself, I'm honing my own skill, not just knowing how to use a PowerPoint and use a Word doc. No, we've gone past that area now. There are attacks on system. I mean, we had the event some time ago, and they basically hijacked the whole program from us online, and we're struggling to get our program back. These are all issues that have come to the front right now. So business must invest now because you can't get resilient if you don't invest in processes that will make you strong. And processes that will make you strong through technology, health and safety, very robust human resource system that can get the workers to be in a state of real worker performance.
Fantastic. Thank you so much. I mean, you said something and I'm taking a punchline out of that. Businesses must invest to stay resilient. Okay, fantastic. Faith, very briefly, okay, what are your thoughts from an HR point of view with regards to resilience? And I would quickly like you to take, again, very briefly, some of the aspects of what Dapo has talked about. He talked about attacks on cyber security, attacks on IT infrastructure, maybe on servers, and so on and so forth. And we are saying work from home or maybe even work from anywhere has come to stay. So I can stay at a restaurant and try to log on. I can stay somewhere and try to, but then I'm opening my organization's IT infrastructure, to attacks, to malwares and things like that. Where do we go from here? Where is the balance between these two competing aspects?
Okay, excellent. I mean, that question, I think, is at the heart of this entire conversation, because if I look at the word resilience, I like to look at it from the point of your regular elastic, its ability to go to the extreme stretch and come back to the previous shape.
Mm.
So that's, no matter how difficult the times are, an organization being able to go through it and still exist, and not just exist as a carcass, but exist maybe, I mean, hopefully in a better form, right? So from that point of view, for businesses to be termed as resilient, you can't test it on the paper. You just have to imagine and assume worst case scenarios and say, okay, what is the worst thing that can happen? And if this happens, how can we respond? How should we respond? And how will we respond? That's been documented in a business continuity plan with various levels, level 1, level 2, level 3, and knowing when to trigger each. Now, prior to COVID, a lot of organizations that are health and safety savvy would run drills. Let's assume that this entire facility is on fire. What's going to happen? What are we going to do? The organization runs a drill, or okay, we're going to move this batch of workers to this location, or you guys are going to work from home. So today, let's assume our place is on fire. What are we going to do? They will run a drill and run through and through, assuming that these were realities. And I suggest it's something that every organization should take into perspective and make a plan for. It might not be COVID, like you said. It might be anything else, like Dapo mentioned. It could be fire. It could even be death of an employee on your site. Someone falls down on your site and the passes, are on, not even out. What would you do? Right. If an employee walks into the office and that's their end, what is going to happen? Every organization should think of worst case scenario in different dimensions. We run a medical services. If there is an infection, right in the entire workforce, God forbid, we would say, but can we assume if that happens, how are we going to run? How are we going to work? So every organization should look into this. So speaking into cyber attacks and
unfortunately, Faith, I will need to stop you. I'm also trying. You have a lot to say, and I say that it's bubbling right through you. But if you pardon me to cut you short, because I want to see how we can be also efficient with time. And I think what I have taken away from your inputs as well as Dapo's is, on one hand, organizations need to invest on systems, on IT infrastructure, and then on the other hand, or further on, they need to prepare or do a lot of worst case scenario planning. They need to do a lot of what ifs, and plan for the different credible scenarios that can occur. I see your finger up. Yes, I will.
Yes, please.
I'll allow you 10 seconds.
Quite, 10 seconds. I think also that based on the realities we have now, organizations have to train their employees on cyber intelligence. What are those things? How do you recognize phishing? How do you recognize malwares? What are those things you should not do with your passwords? Not just the way the banks give us. They have done well at that level, but if you use, a lot of us might not know, if you use a free Wi-Fi somewhere, you have exposed not just your organization, every data on your system can be accessed when you use a free Wi-Fi in the place. So it's important that we train our employees on all this intelligence, especially cyber intelligence, just to ensure that the business is not exposed unnecessarily.
Fantastic. Thank you so much to both of you. I think we've got a few questions, and sadly, we've got only 5 minutes to the end of the time. But let's see how many of these questions we can quickly take. Let me start with the one that says, some of those questions have been answered in the course of the conversation, so I'll skip those ones if you don't mind. Um, okay, someone is asking about a question about domestic violence. I think we talked about that. Domestic violence in recent times have been noted to influence mental health or psychosocial health for workers working from home. How can organizations manage this new concern? I think we talked about that before. If you allow me, we'll skip that. Right, I see this one. COVID has changed the dynamics of the workplace. I think we'll agree. How can line managers embrace trust of their team members with regards to working from home? Because I think that has to do with a lot of trust, especially where technology, monitoring technology and pacing technologies are yet to be deployed. How do organizations manage only on the virtue of trust before we talk about technology? Faith, 10 seconds.
Okay, so quickly, 10 seconds. Over time, this issue of trust has been an issue. It's been quite a critical one. And how I've encouraged managers, employers to approach it is because trust is very delicate. It's either you trust me or you don't trust me. And if you don't trust me and it's expected that I'm supposed to invest in you to trust me, which means I've got to always, do the best to redeem that image of distrust, we're going to continue that battle of trust or no trust. So the best approach is to set clear KPIs. Set clear KPIs. It might look tough, but if I tell you that, every Monday I want this report telling me you have done so and so number of things I've asked you to do previous days, and I want this to happen in the conversation, I want to see it, and I'm tracking it. That's even for manual environment. If that is happening, there's nobody that's going to come and tell me that I'm not doing my work. I know what my work is supposed to be, and I'm getting it done. But if I'm not clear what you are expecting me to do, assuming that I'm not at an executive level, think about the junior workers, think about the middle level managers that still require level of management. We've got to be very clear as to what our expectations are, and then ensure that we are tracking based on what the expectations we have set.
Fantastic.
Yes, trust is key, but if in case there is no trust and that's the only situation we have, then we've got to make sure that we set right KPIs, clear KPIs, and we've got to be objective in measuring them. So you don't go and sack someone that you have not told to deliver something to what extent.
Fantastic. Thank you so much. 10 seconds is a very short time to put those fantastic dots together. I realize that. Another question, and I'll shoot this Dapo's way. Where's the place? We've talked about setting up workstation at home, and for someone like yourself, you've got this cap on your head that is always sat there, health and safety cap. So you can probably do your own workstation ergonomic assessment and fit it to yourself. But for someone like Madam Faith, who also is able to afford a workstation, who does the fitting for her? Your thoughts.
Okay, so thank you so much. I saw that question and I just laughed because that aspect of ergonomics is even one that even in Nigeria, we have not started at all. You go to workplaces and you see at this time I'm even talking about big time workplaces, and you see the condition by which people either sit or walk, then you understand that aspect of health and safety specialism is still something that is remote to us. So even for me, I'm not an ergonomist, I'm just a health and safety person. But do you know what I do? I know to say, please, I need a chair that can at least support my back, and I know the basics of what he said. And they tell me, is this amount? I say, no, it's too expensive. Get me something smaller that can still do the same work. Reason is, have I ever fit my chair to my table? The answer is no, because it's not real. That's what Faith said here. There are so many aspects of this that is still far remote from us. We are going to get there, but I think, again, COVID-19 is making that come to us faster than we've ever thought about. Because in 2 years, 3 years, the workers that you have left to work at home are going to come back unable to stand. and then you understand that you have caused a major damage to them while they were working at home. And then that will be employer's issue, because I told my worker to go home and work. I didn't tell them how to sit when they get home, unfortunately. So, and that's the situation right now. So we are going to get there, but this big deal, I'm just happy that COVID-19 has brought it faster. So we will all be doing the catch-up games right now.
Fantastic. Fantastic.
If I may add, I'm sorry, if I may add, one of the ways...
Now I give you 5 seconds.
One of the ways to do that, right, is, yes, I can't go to fit it because I can't afford it or whatever. You can train them on how to recognize an ergonomic chair. Maybe get a health and safety person or an ergonomic specialist to show them what it means. And then, when you want to do this, this is what it should look like. Then the question will be that you have provided an opportunity for the people to ask you to, foot the bill. But you have done one out of the, maybe 2 of the, or 3 of the problems. You have shown them, you have trained them on how to recognize an ergonomic chair. Maybe that can also help.
Fantastic. And I also know, just to take your thoughts for the Faith, that apart from even the recognition of the kind of furniture they need, there are many free online materials on how to set it right, how to save, how the monitor should be at what angle, how you should avoid glare and things like that, which you can signpost your employees to, to be able to do that by themselves. It's very sad. You know what they say, that time flies when you have fun. It's very sad that we are now just at the end of this session. I like to keep it to 1 hour. In terms of the polls that was conducted with regards to Akin, can we mute people not talking? Thank you. So with regards to the poll that was conducted, asking the question. Asking the question about your preference for working from home and working from the office. 27% of people who responded just on this call said they would like to continue to work from the office. And an overwhelming 73% said they would like to work from home. People like Dapo, who would like to work from home. Okay, so but I think we do realize, as we've all been talking about, that there are many aspects to this concept of working from home. At least we agree on one thing: it is here to stay. But how we take advantage of it, how we manage it, how we coordinate it, how we measure the productivity, these are things that need to be thought through. Even how we schedule, how we write employment contracts will need to change going forward. The legal clauses will need to change. Health and safety provisions, how risk assessments are conducted, they would not be conducted corporately anymore. They will now be conducted individually. And that needs to be thought about, as we go ahead into this whole concept. Thank you so much for everybody who has joined us on this maiden version. I hope that this stimulates you and you would want to be part of it again when we come around again in September. We will get across to you nearer the date for when that will be and what the topic will be. I'd like to particularly thank Mr. Dapo Omolade for joining us today. I'd like to particularly thank Mrs. Faith Akintunde for finding time to come and share with us out of your wealth of experience. I'll take one last question. I will ask one last question, and 10 seconds, and this time I mean 10 seconds for each of you. Dapo, look into your crystal ball. Tell me, when will COVID go away? 10 seconds.
COVID isn't going away as far as I'm concerned. It's here to stay.
Forever?
Well, it's just going to be one of those things. We've got the vaccine, but I don't think it's something going away. It's just going to be one of those things that we have staying with us now from medical field. So it's going to be there for a while.
Oh, you are very pessimistic. Okay, COVID is here to stay. Right. Okay. Your final thoughts on that. Look into your crystal ball and tell me, when will COVID go away, Faith?
I'm not a prophet, so it's a difficult one. But if I just use permutation and combination, considering that it started and then there was the second variant, whatever it's called, and then we now have the Delta variant.
Yeah.
I mean, it keeps advancing. So if we want to base it on that historical data, current realities, I could agree with Dapo. And but I don't want to agree with him because I want to believe that things can always get better. There have been pandemics and people have come out of it. But if we also look at some other ones that came around over time with vaccine and all that, it eventually becomes a reality around us that we continue to live with. But we're able to cope with it. Yeah. So it's neither here nor there.
Therefore, okay, you try to play it safe. You try to play safer than you did. Okay, I think in the time we've been talking, the polls have changed slightly. We now have 65% of people favoring to work from home against 35% of people favoring to work from the office or outside of the home. So this is where we draw a curtain on the program. Again, on behalf of the management of Medbury Medical Services, it's to say a huge thank you to everybody who has been on the call, all the 65 of you who have joined this call. The call, I believe, is recorded. I think that can be made available. Maybe Akin will tell us about that after. Thank you, everybody, for finding time to spend your Saturday evening with us. Thank you, Mr. Dapo, and thank you, Mrs. Faith. Until we come again your way in September, stay safe, stay healthy, and Dapo said that COVID is not going anywhere. So please continue to keep your social distancing and to wear your PPEs. All right, bye for now. Bye-bye.